I couldn't find a better title than Act Now and Eliminate Cervical Cancer, which is the tagline for the day that we are celebrating today. And really, I think my heart goes out to Dr. Tedros when he made this call for action to eliminate cervical cancer in 2018, because ever since his call was made, countries have been pledging to join into this effort. Cervical cancer was a problem before that as well, but it just seemed that we can't do much about it. And the truth of the matter is that every life counts. And today we are very, very pleased to celebrate with all of you and our audience who have been kind enough to join us the first official World Cervical Cancer Elimination Day, which is actually the 4th birthday of the launch of global strategy to eliminate cervical cancer. We all know cervical cancer is a common cancer, more so in the poor countries. Over 600,000 women were diagnosed in 2023. More than half of them died. And the bigger tragedy is that almost 90% of these women live in countries like ours. Every single minute, one woman will develop cervical cancer across the globe, and every 2 minutes, one of them will die. And in the East Mediterranean region where we belong, every hour a mother or sister or daughter or wife loses her life to this cancer. Coming to Pakistan, 15 women are diagnosed with cervical cancer every day, out of whom 8 or 9 die. And I think the human perspective to that tells you that it's like a Boeing 777 full of 250 passengers crashing every month across the calendar. And these are our daughters, sisters, mothers, who leave the homes literally disrupted. And not only this, there's a severe intergenerational devastating effect of cervical cancer. This is only second to breast cancer. And there are over 200,000 maternal orphans due to cervical cancer. And we all know that this is just the tip of the iceberg, because cervical cancer is a cruel disease. It chooses its targets very cleverly. They are the poor women, they are the underprivileged women, they are the women who are not socioeconomically strong, they are usually the women who are not empowered and who don't have resources. So, coming back to the global strategy, the strategy gives us now 3 clear targets: 90, 70, and 90. And following the global strategy, since our region in the East Mediterranean it's a very different part of the world. We have our social problems, we have our socio-cultural issues, we have our economic issues, we have our geographical issues, terrain issues, and on the top of that, we have either a man-made or a human disaster at hand, or a natural disaster every now and then. So our region, East Mediterranean region office of the WHO, then devised this regional strategy for elimination of cervical cancer. And it took into account the same 3 factors that there are in the global strategy, but also action 4 and 5, which relate to health system strengthening, communication, and social mobilization. Now, we are all very familiar with this slide, because there are barriers and there are barriers and there are barriers. But there is still hope for cervical cancer to be eliminated, because this is one cancer that we know is largely caused by human papilloma virus, for which a vaccine is available, and a huge window of opportunity exists for us to intervene doing the second target of WHO if we can examine those women in their reproductive age. So the vaccination is here now, which is absolutely brilliant. It's WHO pre-qualified. The one that we are using in Pakistan is Sicolin. It protects against the 2 strains which cause 70% of the cervical cancers. It has been FDA approved since 2006. 600 million doses have been given so far. We know it works. We know it works very well. There's long-term immunity, and we also have the strategic advisory group recommendations from WHO, which now say that one dose is good enough. So all these barriers, which would have been impossible to negotiate with this 2 or 3 dose, can now be negotiated for low-risk girls. And the important message that we learned we should be given is that it is not only cervical cancer, but it is also majority of the male cancers that can be protected if we give the vaccine on time. And the good news is that there's a series of studies coming. This is the first one of them from Scotland, that in the cohort of the girls who had been vaccinated 17, 18, 19 years ago, there's a 0% incidence of CIN2 and higher grade precancer. We are very pleased that Pakistan is the 154th country in this map, which is a live document by the World Health Organization. And the campaign in Pakistan started in September 2025. It's the first ever of its kind. We had the vaccine available privately for a little while, a decade ago, but that was just that. We were using a multi-age cohort, 9 to 14 years old. The target was around 13 million girls. The campaign was supposed to be mainly school-based, but also community and mobile outreach was being used. These are just a few pictures of all the stakeholders, majority of whom are here with us today, including the SOGP, the religious people, groups, the private teachers, organizations, experts, our health minister from Punjab, media groups. And then this is finally the grassroots working in the schools, talking to the parents, talking to the teachers, and of course the girls. And these are snapshots from the campaign. You can see most of our partners present here for their excellent contribution to this campaign, because HPV is one vaccine which doesn't require one specialty. It requires pediatricians, it requires general physicians, it requires gynecologists, it requires epidemiologists, it requires EPI, it requires every part of the machinery, and obviously the vaccine, which was obviously came through the generosity of Gavi. So the campaign was extended because in the initial part we weren't doing very well, but finally we got there. 9 million shots were given, around 70% coverage, of which only 1/5 was school-based. And the reason for that in Punjab largely was that there were floods. The government machinery was entirely directed to the floods those days, and the schools opened a couple of weeks later. So many of the parent teacher and the teachers meetings could not be held, but nevertheless, we had a pretty good result from the campaign. And of course, then there's this media pulling your legs. This wasn't HPV vaccine, this was a tear gas due to something else. But then, we always relate to our own kind. So on day 4th of the campaign, our federal health minister brought his daughter, Rija Kamal, who had never been seen otherwise, his family. And you can clearly see that the graph for the refusals went down after her vaccination. The graph for vaccination went right up. And this is a little girl whom actually I discovered I had delivered. And she became our advocate. And
cervical cancer को रोकें शुरू होने से पहले.
Cervical cancer. She was a very strong help when we went to the schools. And now just coming back to the window of opportunity I was talking about, from a normal cervix to an HPV infected cervix and to developing a cancer, we have a huge window of 10 to 15 years, maybe longer. So according to the WHO recommendations, if we are able to examine our women at least twice between the age of 35 and 45, we can pick up these changes early when she can be treated entirely and doesn't have to suffer. At the moment in Pakistan, we hardly screen less than 2% of our populations, and we usually use the pap smear or the visual inspection with acetic acid. But we are hoping and making a case to the WHO and the government and all our stakeholders, and this is a great opportunity to do that again, that we should switch over to the HPV testing because that is the gold standard. It is economically very feasible. It is easy to do, even as a part of self-care. The woman can take the samples herself. It is very reliable. It can be done in the primary healthcare. Universal healthcare package can just simply include it, and it will then finally result in a great return of investment by reducing the burden on the tertiary care centers too. And then finally, we need to develop the colposcopy centers for referral, diagnosis, and the treatment centers. And the situation analysis that we did for WHO clearly shows that we have a stark deficiency of treatment centers. And if the number of cancer cases is actually reduced, that will help us in the longer term. So I hope with all of you as our partners and actively working for this cause, we will within our lifetimes see a shift from cervical cancer from a killer to the point that our children and grandchildren can talk about cervical cancer as a disease that used to be. Thank you very much for joining us, and thank you very much for all the work that you do. Thank you. Right. Okay, I will have the honor of presenting to you now Dr. Sophia Yunus, who is the Director General of FDI and the Ministry of National Health Services. And she's one of the people who literally works from her heart. And I'm very, very proud to know her. And I can speak and speak and speak about her, but I think I'll just let her speak and give her presentation. Dr. Sophia, could we please?
Can you hear me?
Yes, we can.
Okay. I'll just run through the initial slides, as most of them would be just a duplication, which you have already alluded to. So I'll be talking about the government's perspective. Whenever the government takes a decision, it is based on, the burden of disease. And when we thought of introducing HPV vaccine, we first looked into the burden of disease. And this is the data that showed that by 2030, approximately 800,000 new cases of cervical cancers are going to be diagnosed annually. And since this cancer is affecting the developing world mainly, and Pakistan being a part of that, so we'll be having most of the burden in Pakistan as well. Next, please. And as we see, we have very limited data available, but at the moment, cervical cancer is the third most leading cancers among the women, and it is the second most common cancer of the women of reproductive age group. And, it is after the, you can see here, the breast cancer is number one, then are the oral cavity cancers, and the third one is the cervical cancer. And Pakistan has a population of 73.8 million women, and more than 15 years are at risk of, developing this cancer. Next, please. So as we already mentioned, that primary prevention, secondary and tertiary prevention were the part of the global WHO recommendation, wherein, we took the part of the primary prevention. And I also wear the hat of a ministry, as there I'm the director programs. So the secondary and tertiary prevention planning also comes under the ambit of the Ministry of National Health at the national level. Next, please. So following this global strategy to accelerate elimination of cervical cancer, referring to the 90, 70, and 90% global targets, we really, worked for the 90% of the girls being fully vaccinated for HPV vaccine. Next, please. So while moving towards the strategy, the National Cervical Cancer Elimination Framework was developed, and it included a 3-year costed implementation plan that is aiming to reduce the incidence and burden of the disease from the country. It also includes increased coverage of HPV vaccination, of course, after its introduction, and then increasing the coverage for screening and treatment of precancerous lesions, and also the invasive cancer once it is there, so provide the palliative therapy also. Then this cancer strategy needs to be rolled out in the provinces through the provincial action plans that are currently under development. Next, please. So here you have already seen Pakistan in green in the world map, and is among the 150 plus countries that have introduced at least a single dose of HPV vaccine. Next, please. So, Pakistan had a phased approach because of the availability of vaccines and preparedness of different provinces that were ready to start the campaign in schools where we were aiming that our main bulk of students would be. So Punjab, Sindh, AJK and Islamabad were the first to go, where the target was 74%, and then KP in the next go, where it is 18%, and Balochistan and GB also to follow with 8% of the target for this 18.06 million that we are aiming to, while reaching to the 90% of our population. Next, please. So we conducted the first wave of campaign in Pakistan, starting from 15th of September till 27th. And, our target was 13 million, while, there were some catch-up days also. So the total vaccination that we could reach was 7.7 million in initial days that were allocated. But since there were floods also hampering the coverages of the provinces, so we extended the days, and 15% target was achieved during these catch-up. And due to some, strikes and lockdowns in Azad Jammu and Kashmir, the coverages could not be optimal. So they took another week to continue that vaccination process. So about 3.7 million of these girls were refusals, and they were recorded in the campaign. Next, please. So we also got some lesson learned, and initially when we were about to begin the campaign, the social media became an enemy of us, and false claims were flooded all across the social media, and that really eroded the trust of the parents, and as a result of which we had to come with Plan B. There were a lot of myths and misconceptions regarding infertility. It was considered to be foreign conspiracy. We knew already in polio campaigns that such type of agenda was always surfacing, but to our astonishment, we were not, thinking to that extent. And people really was following them, and it really impacted our vaccination coverages in initial days. You have seen that graph that Noreen has already shown. So that was the reason for which, we were not planning to initially. So we had to come up with Plan B, and we engaged the credible influencers and doctors, because once the doctors are talking, we thought that it will be really useful for us to, build the case. And at that time, you have already seen the minister's role, and then other ministers and the legislators, they came forward, and they contributed to building the trust of the community. So our political leadership, they followed the footsteps of the Federal Minister for Health. Next, please. And in this way, we found out that education department, our strategy was to reach out to teachers through parent-teacher meeting. We were aiming that, the parents would be reached. But when we went to schools during the days of campaign, we found that the children were not there in the schools. There was absenteeism. Parents did not send because, they did not trust what the teacher has told. And some of the teachers were also found biased, and they said that go and reach out to the parents themselves, because we cannot ensure that this vaccine is safe. And in this way, really, we had to re-strategize. We asked all the CSOs that were there, UNICEF, who was involved in advocacy sessions with the communities. They were also there, and in the end, we were ideally, that could have been done earlier, but we were able to reach to those communities and convince some of the parents. Next, please. So, the questions that the parents asked were mainly, what is the purpose? Why are we giving them? Because whenever they were searching on Google, the misinformation was much, and most of them were reaching to non-technical and the fraternity that did not they were not supported by the doctors or the technical people, and as a result of which it resulted in less confidence of these parents in the vaccines. As a result of which we shifted from outreach strategies to the communities rather than schools. So in this way, as we already seen the percentage, which was not accustomed to, which we have in our schools in previous years, but this our strategy did not work in HPV. Next, please. So in this way, if we are to ensure this campaign in future, we are really, formalizing our strategy for KP, Balochistan, and Gilgit-Baltistan. We continued, so now whatever resources are left, the vaccine that is available, it is still available in the fixed sites, and we'll continue to do this till 31st of December. And, a catch-up session will be conducted in provinces and areas where we have a lot of doses available and the children are missed. At the same time, we are going to have school-based vaccination sessions where applicable under RI until 31st of December or until the vaccine stocks are exhausted. Next, please. So this is all from my side. And this, the shock that came from social media is building our management style and also better planning as we move in phase 2, which is KP, and then followed by that Balochistan and GB. With this, I stop here and happy to take questions if there are. Thank you.
Thank you very much, Dr. Sophia. It was excellent. Could we take the questions at the end of the talks, please, together, if that is at all possible? Thank you,
Sure,
Dr.
sure.
Sophia.
Thank you.
Thank you for highlighting the national strategy and the provincial action plans, and obviously the challenges and the lessons learned. And I think it is important to just learn from those lessons. And I hope that in the next campaign, we are going to do better on these issues. Thank you very much. I now have the distinct honor of introducing Dr. Mohammed Afifi, who is the Regional Advisor Women's Health in WHO Eastern Mediterranean Region Office. And I think I will just let him talk because no words are able to describe or introduce him better than himself. So Dr. Afifi, the floor is yours, please.
Thank you so much, Dr. Noreen, and thanks to all colleagues who are really behind organizing this very important and timely webinar. And give me a second to share my screen, please. You see the screen now? Can I get any confirmation that you see it full screen, please?
Yes, we can see
Yes.
you.
Yes, we can see.
Okay, thank you so much. This is a very, really important point in time that we're having today, because eliminating cervical cancer, and for the first time, humans can eliminate a type of cancer. And today is a very special day because this is the first ever official commemoration of a cancer. For WHO, we have plenty of health days and each is dedicated to a particular health issue. But today we are commemorating for the first time a cancer that is dedicating this day for eliminating it. And luckily, it's a cancer that is eliminatable. And this is, as we heard from Dr. Noreen, the fourth birthday of the global strategy to eliminate cancer and is the first observant, as we said. So now we are actually part of history making. In few years' time, people will be speaking about the year 2025 and November 2025, where the first observance of this cervical cancer elimination day took place. But let us please spend a few moments to leap into the future and to see what's happening, for example, if we jump into the year 2050. So now we're in the future, 25 years from now, and we estimate that every 2 minutes, 4 new cervical cancer cases would happen and 2 deaths would happen as a result of cervical cancer, which is, again, we need to keep reminding ourselves that it's a preventable cancer. Let's go a bit back into the future for the year 2030, the SDGs, Sustainable Development Goals, end line, where we estimate also that every 2 minutes, so at the same time span, we'll have 3 new cases of cervical cancer and 1+ death, again, from a preventable cancer. Going back in time to today, we're in the year 2025, and this is the situation globally and in the region as well. These 2 graphs that we see on the screen carry lots of messages, and we can spend hours discussing them, but I would like here to highlight 2 key points. One good point, or relatively good point, and one relatively not so good point. The relatively good point is that if we look at the right side of the screen, the EMR graph, the Eastern Mediterranean region graph, we are at a much lower location on the graph in terms of incidence and prevalence and mortality that's happening due to cervical cancer compared to the worldwide or the global situation that we see on the graph on the left side. But the not so good side of the graphs that we are seeing now is that the projection on the right side for the region is going at a much higher pace than the global situation. So the global situation might plateau after the year 2050, but for our region, yes, we are starting at a much lower point, but we are going up at a much faster pace than the world. What are we trying to do at WHO to address women's cancers? We have a global cervical cancer elimination initiative and a global breast cancer cervical elimination initiative as well. And as we heard from Dr. Rayn, these are the 2 top highest prevalent, most prevalent cancers among women. Breast cancer is first, then cervical cancer is the second. But let's focus on cervical cancer because today is the Cervical Cancer Day. And we saw already from previous speakers, and Dr. Noreen also highlighted it, that we have the global strategy that was endorsed by 194 member states and the observing states for WHO with the global targets, the 90, 70, 90. And at the regional level also, we had contextualized to the situation in the region. But then what? What do we need to do? We conducted a modeling for the situation in 78 low and middle income countries. And it showed us that by investing in the pillars that are highlighted in the strategy, we are projecting a significant reduction in cervical cancer incidence and mortality. And these are 3 scenarios. The first scenario is for vaccination only for girls. The second scenario for vaccination and once lifetime screening and treatment. The third scenario encompasses all the pillars that we have highlighted in the global as well as the regional strategy. So the time now is the opportunity that we have to embrace and to invest in moving into the future and implementing really very efficient and interventions that are very much bringing high return on investment. We estimate that by the year 2050, if we look only at the health burden for cervical cancer, we can prevent around 500,000 deaths due to cervical cancer in the region. This is the region, this is not a global figure. And by 2050, we could prevent this number of deaths. And from an economic perspective, we can save up to $45 billion by 2050 with a return on investment that goes up to 11 times for every dollar invested in cervical cancer prevention. So what are the key recommendations here that we'd like to advocate for and work together with all partners to implement? We have to see it as an investment. Introducing HPV vaccines and vaccination programs in general and making sure that it's integrated into ongoing vaccination programs is an investment. It's not a cost. We need to address also all the bottlenecks that we can encounter in terms of the continuum of care. We need to reach out, as we heard from our colleague from the ministry, that there are campaigns at schools, campaigns at primary health care. We need to use every opportunity and to make sure that we are embracing the three pillars of the strategy, not just vaccination, but we need to have this sort of comprehensive approach to eliminate cervical cancer, which is a preventable cancer. In order to do this, we need to have a all hands on deck approach. We need to work together. Academia, United Nations, government, civil society, every one of us has a role to play. It's not only the ministry's responsibility or academia or the international development community, but we all have to contribute to protect our girls and women from this preventable cancer. I would like really, Dr. Noreen and colleagues, to thank you for this opportunity and to confirm to you and to all colleagues and partners that we are here to work together. It's a long journey, but together we can make sure that all our girls and women are protected from cervical cancer. Thank you so much, Dr. Noreen. Over to you.
Thank you so much, Dr. Fifi. Thank you so much for this wonderful talk, which really gives us the whole perspective, because as clinicians, we think this cancer is extremely important. But then obviously for the government to allocate the resources, there are so many priorities. There are disasters, there are wars, there are IDPs, and it's a matter of life and otherwise. So for them, it's really important to know that the return of investment, and it's investing in the human capital and saving those women's lives and those families from disruption is really important, because we need that support for them to, for the policymaker and for the financial gurus to actually allocate resources. Thank you very much for that. Thank you, sir.
Thank you so much, Dr. Noreen.
Thank you. Thank you very much. And now we have Miss Ellen Thom, who is the Deputy Representative for WHO Country Office and is a very seasoned public health leader and a beautiful person inside out. You can read all her accolades all over the place, but I think I will just invite you, Ellen, to say the beautiful words that we are going to hear from you. Over to you. Thank you.
Thank you so much, Dr. Noreen, for inviting us to be part of this webinar. We don't take it for granted, and it is an opportunity for us as the country office also to highlight how we contributed, what was our role in terms of the HPV vaccination introduction, as well as the key lessons learned that we have had throughout the process of the first phase of the introduction. First of all, for us in Pakistan, this is a major step forward to introduce the cervical cancer prevention. And also, it was an opportunity for us as WHO to play a central role in supporting the government of Pakistan at every stage in this process. We worked closely with the FDI and also the provincial and area EPI programs. We also provided technical assistance in planning, implementation, monitoring, evaluation, and integration of the HPV vaccination into the routine immunization system, which is now the next step forward. Under planning and coordination, next slide please, the WHO supported strategic planning and coordination, helping the government develop national and provincial progress work plans, convene regular technical working group meetings, and also ensure alignment amongst the key partners that were involved in this. We also conducted readiness assessments, next slide please, by contextualizing national tools and developing online dashboards, identifying assessors and facilitating periodic reviews of campaign preparedness across provinces. And we also supported government teams in conducting periodic readiness assessment across the provinces. We also were involved in the training and capacity building. Next slide, please. The major component in the training and capacity building was the development of comprehensive training plans, because we had to be systematic, that we don't leave any province uncovered, and finalize the materials that were supposed to be used, and also delivery of microplanning and operational training across all levels, from national trainers to frontline vaccinators. We also did support monitoring and evaluation. This was to ensure quality implementation. WHO led extensive efforts in monitoring and evaluation, including development of pre-campaign readiness checklists, training monitoring tools, daily district reporting formats for the campaign, MIS to track campaign progress in real time, and post-campaign coverage survey. How have we done throughout the campaign? What went wrong and what went right? And also helping ensure timely and robust evaluation of outcomes. What have we learned throughout this process? As the campaign unfolded, several important lessons emerged that will help to strengthen future vaccination rounds, since this is a phased approach. So what we have learned from the first provinces will also inform the provinces that are coming in the upcoming phases. Under advocacy, communication, and the social mobilization, SCSM, this was one key. Next slide, please. This was one key area, and we have learned that it's essential to build trust in order to reduce hesitancy. Dr. Our colleague from the FDI director mentioned about the issue of hesitancy, which was real. This advocacy, communication, and social mobilization is a key effort to ensure that we build trust and reduce hesitancy. Timely crisis communication also helped counter misinformation circulating on social media, particularly myths related to fertility, and high-level endorsements also boosted public confidence. This was also mentioned by FDI. Although we need to boost public confidence by increasing the quantity of communication materials such as banners and city branding, as well as make sure that we fully meet the scale of the demand, especially in major cities. This is a lesson that we have learned moving forward and strengthening the advocacy, communication, and social mobilization component throughout the area, and proactive engagement with media communities and influencers to ensure that we have vital and more prominent future campaigns moving forward. The education sector, also our engagement with the education sector, this was another critical lesson that we have learned, and it was a very important sector in this case. And while the school-based vaccination strategy was appropriate for reaching the target age group, coordination with the education department and private schools began quite late, and confusion surrounding the consent form letter. You remember there will be need for a consent letter, and then later there will be no need for consent letter, and then there was some confusion, and that further disrupted the school-based activities. The future efforts must involve early and widespread parents and teacher orientation at district as well as at UC levels as we move forward. The religious institutions and the AUCAP department also had a role to play. Engaging them also provided highly effective coordination from that side. Once initiated, endorsement from religious leaders helped dispel misinformation and also build trust in communities, and engaging religious institutions area would further strengthen community acceptance moving forward. Again, the medical and professional associations, next slide please. The partnership with the medical and professional associations, including PPA, PMA, and SOGP, were valuable in providing credible advocacy and the community assurance. However, engaging bodies earlier and more consistently would have amplified their impact. So this is also a lesson that we take moving forward, that we should involve these bodies as early as possible in the planning as well as the implementation process. So as WHO, our role has been comprehensive, spanning from the whole process of planning, readiness, coordination, training, monitoring, and collaboration with the FDI and the provincial programs and the implementing partners. And we have made sure that we have strengthened capacity in the introduction of the HPV vaccination and integrate it sustainably into the routine immunization. This is our way forward. We continue with the monitoring, evaluation, and also ensuring that this vaccine finds its way in the routine integration and it is available at all times when the relevant age group is willing to get it as we move forward. Thank you so much for the opportunity.
Thank you very much. Thank you very much. And we all appreciate the role of WHO in supporting the government at central and provincial levels, and especially the healthcare workers that were trained, 49,000 of them who were instrumental running these campaigns. Thank you very much. And now I have the honor of introducing Ms. Amna Khan, who is the country director for GWHI and has been doing good work in all the places that she, and now we have her heading GWHI, and they played a very, very important role in this campaign. Over to you, Amna. Thank you so much for joining us.
Thank you so much, Dr. Noreen, for the introduction. And of course, good afternoon to everyone. And again, I thank you for giving me this opportunity to share how GWHI has contributed and supported the Pakistan's national HPV vaccine campaign. And of course, the key lessons that we have learned along the way. So GWHI has been at the heart of Pakistan's national HPV vaccine campaign. We have been working very closely with the Federal Directorate of Immunization, the provincial EPI teams, and the key partners to make this historic effort a success. Our role has centered on technical assistance, capacity building, and strong stakeholder engagements, which I think are all essential for delivering the HPV vaccine effectively across both schools and the communities. And to kick off the campaign, we led the readiness assessment, micro-planning, field monitoring, and the supportive supervision, ensuring that the vaccinators has the systems, tool, and guidance needed to reach the adolescent girl safely and efficiently. But we know that delivering a vaccine is not just about logistics, it is about people. That is why GWHI invested heavily in training frontline workers, teachers, and the community volunteers, strengthening their ability to share accurate information, ease concerns, and counsel parents with confidence. We also conducted orientation sessions and briefing with school staff, local media, and community leaders, and that we did to create one unified, trusted voice for the campaign. One of the biggest challenges, like everyone has mentioned here, we faced was the misconception and the low awareness about HPV and cervical cancer. In response to this, we emphasized strategic girl-centered communication and the social behavior change communication, ensuring messages were clear, culturally appropriate, and aligned across provinces. So GWHI supported the development of a wide range of IEC material, posters, parent leaflets, myth-busting cards, frequently asked questions and answers, and they were all designed to help the vaccinators, teachers, and the community workers communicate consistently and effectively with parents and the caregivers as well. We also expanded our communication toolbox by investing in audio-visual content, including short videos, animated explainers, and visual telling story tools. And these were used in schools, in community gatherings, and online to simplify complex information, to reach low literacy audience and counter misinformation circulating on the digital platforms that were mentioned earlier as well. So these materials were fully integrated into the training to help build stronger interpersonal communication skills. And then, of course, foster trust. Especially important were addressing the vaccine hesitancies. So our biggest takeaway is that trusted, consistent, and timely communication can make or break HPV vaccine acceptance. As Pakistan now prepares to transition from HPV vaccine into routine immunization, continued investment in updated IEC material, multimedia resources, rumor management system, and ongoing capacity building will be essential. So GWHI remains committed to supporting the government and the partners every step of the way, strengthening communication system and advancing Pakistan's vision of eliminating cervical cancer for future generation. This is something that we have learned, we have did, and we are committed to do forward as well. So thank you very much. And I'm
Wonderful.
open for questions.
Thank you very much, Amna. This was beautiful and heartfelt, and we really appreciate the role GWHI has played not only in the readiness campaigns, but also, of course, in this time, the social media, the IEC materials, the SBCC, the way we talk about a thing is very, very important. So thank you for all that work, and it is important that we all continue to work together and supporting the government, FDI, and Gavi, who've been instrumental in bringing the vaccine to us so that we can have a successful run out of the campaign and finally help cervical cancer elimination. And now we have Dr. Quratul Ahmed, the pleasure of introducing you. She is the heart and spirit of UNICEF in Punjab, and I've had the privilege of working very closely with her. And she's also another one who works from her heart. So, Quratul, thank you very much for giving us this time, and over to you, please.
Bismillahirrahmanirrahim. Assalamu alaikum and good afternoon, everybody. And thank you so much, Dr. Noreen, for this beautiful introduction and as well as inviting me to this forum and sharing my experience. And it was my extra pleasure to listening to the insights of the previous speakers, Dr. Sophia, Dr. Afifi, Miss Ellen, and Dr. Amna. Being part of the campaigns in the past, this HPV campaign had been a unique experience in terms of the number of the target beneficiaries, which involved the young adolescent girls, and also for the involvement of multiple partners on ground, apart from the government and the health ministry and department. And we had some great success stories. We had some challenges and lessons learned for the future. I will touch upon UNICEF's role and experience in context of the Punjab province. As a technical partner, we had been part of all the stages of planning, implementation, monitoring, reviews, etc. However, the major support to the department was in the development implementation of the communication campaign. The comprehensive communication plan, it was executed after approval from the provincial and federal EPI offices. Every partner, as Dr. Amna also spelled out, they had their specified role into that. And likewise, UNICEF had the responsibility, which very briefly, which included the provincial and district level capacity building and trainings for execution of community communication activities. There were schools and community sessions for raising awareness and demand generation. There were street theaters and community folk sessions to address the myths and misconceptions regarding HPV and cervical cancer. And in lieu of that, 30 street theaters were conducted. Then community level dialogues and interactive community sessions with the key community members on the myths and refusals, they were conducted, and around 600 sessions were conducted. Likewise, provincial and district awareness sessions were conducted, seminars with professional associations like SOGP, like Pakistan Pediatric Association were important. Likewise, can you please move further? Next slide. Yes, media orientation was held. Initially, one was planned, but the provincial EPI, they recognized the importance of involving the regional and the national media. So more media orientation sessions were conducted, and healthline staff were also oriented on the HPV vaccine. Likewise, mobile miking was done in the communities to inform about the campaign dates and raise the awareness about the campaign. Crisis communication, orientation, and action planning remain one of the major areas. And our federal office, they also supported us in robocalls, SMS campaigns, mass media campaigns, production of the videos, audio, video documentaries, production of the social media contents, robocalls, and some IC material banners, they were also distributed. Video testimonials of the experts of the field were also developed and disseminated. Next, please. For the school and community sessions, we conducted the provincial TOTs, and the master trainers, they then conducted the district cascade trainings. And more than 2,100 district staff were trained, who then contributed in the school sessions. More than 12,000 school sessions were conducted, and around 6 million children were approached through these sessions. And likewise, community sessions, more than 4,000 sessions were conducted. And yes, next please. For the mobile miking, around 800 social mobilizers were engaged, and mobile miking, it remained a part of the micro plans and provincial EPI. They also conducted additional mobile miking, keeping the importance of the activity. And our ComNet staff, which is the polio staff, they also contributed in this exercise of reaching to the religious leaders in the communities and influentials in the community. These are some few glimpses of the communication workshop. Next, please. District level training, then session with the girls. Yeah. Next, then street theater. So the campaign was launched in tough circumstances, including severe flood in several districts. However, the strong commitment, proactive follow-up, and strategic leadership by the EPI Punjab and also federal EPI, they played a pivotal role in driving the HPV vaccine campaign forward and effectively navigating all the hurdles. We also learned that engagement of the provincial associations and the involvement of the senior officials and the health ministers, they all boosted the confidence of the communities. Then we also learned that engagement through multiple channels, WhatsApp, mosque announcements, they all played an active role in countering the myths and increase. However, we also learned that misinformation, especially about infertility and population control, it spread faster and rapidly than the official messaging. And as Dr. Sophia also mentioned, then communication strategy had to be revised. And robust media monitoring was done, rapid response teams were engaged, and it was timely countered. The testimonials of important personalities, especially the experts of the field, gynecologists and pediatricians, they did help a lot. Next, please. There was some delay in involvement of education department and school administration. However, the resistance was successfully countered during the campaign through the meeting of the health minister and education minister and their secretaries, and it was successfully countered. And we learned that involving these departments, education department, very early in the campaign, that leads to a successful activity later on. And more involvement of teacher and parents is the key to trust building within the school and the communities. And not only during the campaigns, but consistently engaging local influencer, religious leader, teachers, elders, and involvement with the parents is one of the lessons we learned during the campaign. And last but not the least, adequate time and correct timing is definitely important for all the district level activities, encountering refusals, because this time the campaign happened during the floods and also when the schools were closed and opened only 15 days before the campaign. So the time was relatively short. However, despite all these challenges, the provincial EPI, through the adoption of timely and effective mitigation measures, succeeded in stabilizing the campaign and Punjab achieved a target of 90%, and likewise the country achieved a target of 75%. And hats off to all the partners in federal and provincial EPI. Thank you.
Thank you very much, Dr. Kuratulan. You literally squeezed the sea into a teacup. Thank you very much. And it is such a panoramic subject and the interventions. Thank you very much for sharing that. And now I am really honored to introduce Marissa Melicone, who is so dedicated to this cause that it's almost 3 a.m. from where she is. And I really salute your commitment, Marissa, and I'm so sorry to keep you up at this time, but we really wanted to have you. Thank you for joining us. Over to you.
Thank you so much. I will share my screen, and thank you again for the opportunity to be here today and to present. So I think that should be visible. Great. So good afternoon, everyone. As Dr. Noreen said, my name is Marissa Melicone, and I serve as the Senior Manager for the HPV Initiative and the lead for the Global HPV Consortium at the Sabin Vaccine Institute. And it's really wonderful to join everyone today on this World Cervical Cancer Elimination Day. And I'm specifically going to just take the next few minutes to speak about a topic that I think has really shown through quite strongly in each of the presentations that we've seen thus far, and that is how strong partnerships are advancing HPV vaccination and driving impact towards the elimination of cervical cancer. So first, I'll just take a few minutes to give a bit of a background on the Global HPV Consortium, and then we'll talk about how this model has really helped drive progress through transdisciplinary and cross-sectoral partnerships. So we launched the consortium in 2023, and the Sabin Vaccine Institute serves as the secretariat, really helping to convene partners, coordinate efforts, and create opportunities for shared learning and collaboration across countries and sectors. And although Sabin is a vaccine-focused institute, we really set out very intentionally to build this consortium across the 3 pillars of elimination, completely aligned with WHO's cervical cancer elimination agenda and the 90-70-90 targets. So in doing so, we are aiming to, of course, achieve that high and equitable coverage of the HPV vaccine and scale up screening and precancerous treatment so no woman is left behind, but also even more so integrating these interventions across the 3 pillars into resilient health systems for that lasting impact. So the consortium is made up of over 60 diverse and transdisciplinary partners, and we really continue to grow. And what makes us so powerful is that it really unites partners, not only from across the 3 pillars of vaccination, screening, and treatment, but really across sectors and disciplines. It's really those implementers who understand local realities, the researchers who bring the evidence, the communicators who shape awareness, and much more. And it includes different areas of expertise, those who work in the HIV/AIDS space, family planning, women and adolescent empowerment, as well as men's health initiatives and beyond. So it's that cognitive diversity, geographic diversity that really makes us strong. So how do we actually bring these diverse partners together and turn collaboration into action? And this slide is just very high level of 4 of our main approaches that really helps define how the consortium builds and strengthens its partnerships. So first, we focus on those regional and country level coalitions, really bringing together civil society, NGOs, multilaterals, academia, implementers, and government representatives under these shared national goals. So for example, we have collaborated with IDESHI, one of our partners, to kick off a Bangladesh consortium for cervical cancer elimination that really unites these diverse actors around shared national goals, helping to translate that global guidance into national action. We also help to catalyze those one-on-one collaborations, creating opportunities for direct partnership between our organizations. So we have 2 partners who have young leaders programs, GIAHC or GWHI, and Women Empowering Nations, that came together to develop an evidence-based HPV vaccine education and science communication training program for young leaders and youth advocates. We also facilitate peer-to-peer learning, which is really at the heart of what we do and the DNA of what Sabin does as a whole. So creating those spaces for countries to exchange experiences and problem solve together. Most recently, we've had a multi-country virtual dialogue series, one of which has showcased Pakistan's recent rollout and allowed for learning across other countries who have had recent rollouts of their own, such as Nigeria and Bangladesh, also doing something very similar in the Latin America region. And finally, in 2026, we're building towards this expert working groups where we're really bringing partners together to tackle these cross-cutting challenges from policy and implementation to advocacy and communication. So it is really together that these approaches create a network that not only shares knowledge, but also drives coordinated and sustained action towards HPV and cervical cancer elimination. And so my last slide here is just about how these strong partnership models really translate awareness into sustained capacity and collective action. We believe that these types of partnerships really localize solutions to community realities, really around that relevance and trust of the local realities. We build shared ownership through co-designed solutions that really foster commitment and continuity. It enables accountability by creating these structures that endure political shifts and funding cycles, and bridges silos that ultimately unites the expertise, the resources, and the infrastructure towards the shared goals, and amplifies those individual efforts to multiply the reach, the visibility, and the impact. And when partnerships are designed this way, they don't just raise awareness, they really build systems that can deliver and sustain progress. And they ensure that local voices shape local solutions, that accountability survives beyond leadership changes, and that every new connection adds momentum to the mission of elimination. So thank you so much for the time and the commitment to this shared mission. Thank you to the organizers for inviting me to speak on this important topic today. And thank you so much.
Thank you very much, Marissa. I think this was the perfect time to have your wonderful talk here, because we are very grateful to Sabin and the HPV Consortium, and that's exactly what we have just tried to do in Pakistan by creating the Pakistan Alliance for Cervical Cancer Elimination, because all of the speakers that you have heard talking about their great experiences and their very key roles, the key is to put it all together, avoid duplication, and put all the brains together, get new ideas, because that is ever so important for a lower middle income country like ours. Thank you very much. It was a wonderful talk. Thank you. And now I have the pleasure of introducing a dear friend, Dr. Sayyida Zahida Sarwar, who is the Director of Health Programs in the Rayn Group, who are a wonderful addition to PACE, or the Pakistan Alliance, and we are very proud to have them working with us and working together. Over to you, Dr. Zahida.
Thank you very much, Dr. Noreen, for a very generous introduction. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and good afternoon, everyone. Thank you, Dr. Noreen, once again for hosting this webinar on cervical cancer elimination, an issue of utmost importance and urgency, and it truly deserves our collective attention. Although being last speaker is always challenging, as the most of the points you want to discuss and you intend to discuss have already been covered, but I will be reinforcing all those key messages. So before speaking on the subject, I would briefly introduce Rayn. Rayn is a public health organization focused on improving health and well-being of women and children using technology, innovations, and strong partnerships at all levels. Let me highlight one of the projects of Rayn, through which we supported polio program, and leveraging technology, we tracked polio frontline workers, pinpointed missed locations and communities, and ensured enhanced overall accountability mechanism. This led to improving coverage and ensuring that all vulnerable populations were reached. So coming to the main topic, as data tells us, and it has been shared by many speakers, including you, Dr. Noreen, that almost 50% of the women diagnosed with cervical cancer, they lose their lives, not due to lack of medical knowledge and technology, but due to the fact that they are screened at a very later stage. And we all know that this data is very limited, as Dr. Sophia has mentioned, and we also know that this data is oftenly underreported. So we should be mindful that the situation may even be more severe. But the good news is that that you all have been sharing that this is vaccine preventable and this is curable as well if it is screened at an early stage. So the two most important interventions leading to cervical cancer elimination are number one, vaccination, and number two is the screening. As you all have mentioned that this HPV vaccine has been introduced into Punjab, Sindh, AJK, and Islamabad as a part of initial rollout. And this effort came with significant challenges as barriers were identified at individual, societal, and organizational level. Although strong IEC campaigns were carried out to address the myths, misperception, and misinformation, but even then, post-campaign analysis, post-campaign informal and formal assessments and evaluation indicate that a more robust, integrated, comprehensive IEC strategy is needed along with strong multi-sectoral collaboration, including media, academia, education department, religious department, involving OCAF department, as already mentioned by some of the speakers. The second thing which we need to do is the cervical screening, and we need to introduce low-cost, simple methods. And you have mentioned visual inspection by acetic acid. We need to introduce these low-cost and simple methods at all level of public healthcare facilities and also at the private healthcare facilities, because 40 to 50% of the women go to the private sector. So along with this, we need to ensure that this is a part of cervical screening, is a part of essential package of health services, is a part of universal health coverage, along with ensuring all supplies and logistics are available at all level of public and private healthcare facilities. Capacity building, counseling, and capacity building, both are important. A healthcare provider working in public and private sector is also very critical. So, in addition to this, I would like to add that we should talk more about the factors leading to high rate of cervical cancer. For example, early marriages, high fertility. These are the factors which we need to include in our communication strategy as well, because we are focusing on vaccination, but we need to focus also on all the preventive measures which we can use for to achieve our desired outcome. So in the end, I would say, Dr. Noreen, that listening to all the speakers, I would say that insights gained from first HPV campaign and from the formal assessment and evaluation will guide us to develop a more comprehensive strategy, more integrated approach, and involving all the partners, all stakeholders for our upcoming campaigns. So thank you very much for giving me this opportunity. I'm so glad to be a part of this webinar. Thank you once again.
Thank you very much, Dr. Zaida. Thank you very much indeed. And I think in the interest of time, we can probably not take any questions, but I think I would just summarize by saying that the galaxy of speakers that we had, starting from Dr. Sophia representing the government, and Dr. Afifi from the EMR region, Ellen Thom from the WHO office, Dr. Amina representing Jepaigo, Dr. Kuratulan representing UNICEF, and Marissa Melchion all the way like 3 a.m. I cannot forgive myself for that, Marissa, representing, you know, the wonderful Sabin Institute, and of course, Dr. Zaida. I think it just tells me that we are all together, we are all on the same page, we all understand that cervical cancer need not to continue and it can be eliminated. And especially Dr. Fifi's presentation for the future and the savings, it's really a very good tool to present to the government and the policymakers when we are asking them for screening programs, which will be soon, and continuation of this vaccine. So thank you very much for all your valuable inputs. You really made this event worth the effort. And I will now just quickly request Ms. Farwa Hussain, who actually heads Rayn, to say a vote of thanks, and then I will come back to your screen just for one last moment. Farwa, do we have you with us?
Ji, bilkul. Thank you very much, Dr. Noreen, and thank you to all our distinguished speakers and participants for joining us today. Your insights and time reflect the collective commitment we share together towards eliminating cervical cancer, and the work that you do and the talk that we had today aligns deeply with Rayn's vision to see every woman and child thrive, not just survive. At the end, I'd just also like to acknowledge that as a mother, this issue is very personal. My own 14-year-old daughter recently received her HPV vaccine, and I saw firsthand how hesitant many parents still are. Increasing awareness and encouraging protection at the right age is essential. We really hope that today's dialogue helps strengthen that awareness and accelerates action. Together, we can move towards a future where no woman loses her life to a preventable disease. Thank you once again for being with us.
Absolutely. Thank you so much, Farwa. And now I will finally thank you all. But just before that, can you please all put your cameras on so that we can have a wonderful remembrance? And I will probably frame it, put it on my table. This, collection of people, mashallah.
Dr. Noreen, if you allow me, I'd asked Habib to leave a contact email because we were unable to take questions. So if to all the participants, if there are any questions after this, please feel free to send them to the email address Habib has shared on the chat box. Thank you. Sorry for intervention.
No problem. And the recording will also be available. So, Habib, we're all set for you.
Sure. In 3, 2, 1. Thank you. We'll take another one just to be safe. Thank you.
Thank you very much. Ellen had to leave, but I took a screenshot and I think we can place a picture somewhere. So thank you, everyone. Thank you, Habibul Arifin Saab, for facilitating this. Thank you, all my worthy speakers. Thank you, Rayn, and especially the audience who have joined us. Thank you very much. Have a great day. Allah Hafiz.
Allah Hafiz.
Thank you.
Allah Hafiz.